And joining me on the broadcast are Dr. Sameer Gupta, Senior Cardiologist, Director, Cardiac Cath Lab, Metro Group of Hospitals. All of us with us on the broadcast to understand what could have happened in this case and why is it that more and more in their 20s and 30s are falling prey to have their lives end at a cardiac arrest. Dr. Sameer Gupta, if I could come to you first, what is your assessment of what had happened in Shefali Jariwala's case?
The first of all, regarding this particular case that we are talking about of Mrs. Shefali, who died of a cardiac arrest, I want to explain further that cardiac arrest is different from a heart attack, right? A cardiac arrest usually happens when your heart suddenly stops for whatever reason. It goes into an arrhythmia, irregular heartbeat, and it stops beating. That is a cardiac arrest. It is caused because of many, many reasons, one of which is a heart attack. So they're two different and distinct entities. They are kind of correlated, but they are two different entities. In this particular case, we know that she died of a cardiac arrest. That's what I read online. But why the cardiac arrest happened is yet to be determined. It can happen because of many reasons, right? One, of course, the number one cause is a heart attack that can cause the cardiac arrest. Electrolyte abnormalities, if your potassium goes up, if you have kidney issues, they can cause your heartbeat to suddenly stop. Sometimes there are drugs which can cause this as well. So there are very many different reasons why somebody can have a cardiac arrest. Now, when we talk about a heart attack per se, the incidence of heart attack is always it's the number one cause of death globally, right? So 1 in 4 people across the world, especially in India, die of a heart attack. And there are many different reasons why people have a heart attack. It can be because of smoking. It can be because of high blood pressure, high cholesterol, diabetes, which is uncontrolled, family history of heart disease. So these are all things that precipitate a heart attack that can subsequently lead to a cardiac arrest.
Wanting to get your point of view, Dr. Sameer, on how far is lifestyle responsible? Because there is only so much that we can do. We all have hectic lifestyles, corporate lives, and even for celebrities who probably go to the gym a lot, have their bodies in shape, but diet, lack of sleep, stress, that can lead to heart-related deaths. Dr. Sameer?
Yeah, so all these the heart disease to a very large extent because of all these risk factors that you just mentioned has also become a lifestyle disease. So if you have a high blood pressure, which can be precipitated because of lack of exercise, being overweight, not taking care of yourself, eating what you want, all these things kind of precipitate all these high stress, lack of activity, smoking. They all precipitate high blood pressure, diabetes, high cholesterol, that can subsequently cause blockages in the arteries of your heart. Now, I would want to point out that in this particular case, this is a female who's had this event. So there are some risk factors which are more prominent in women that can cause heart disease and heart attack, especially after menopause. So after menopause, the estrogen levels in the body change, and they usually have a protective effect on the heart. And once that happens, there is a higher incidence of high blood pressure in women, high cholesterol, especially after menopause. Also, sometimes when you have pregnancy related problems like high blood pressure during pregnancy, if you have PCOD, if you have eclampsia or preeclampsia in pregnancy, or even diabetes during pregnancy, they also significantly increase the risk of heart disease after the pregnancy as well. So there are some unique risk factors in women that can cause heart disease and heart attacks.
That's a very interesting point you've made, Dr. Gupta, because the women are especially listening. Any particular precautions one can take during premenopause for women to stay heart healthy?
There is actually no magic potion to reducing the risk of heart disease. It's all related to lifestyle. Those are some of the important things that you can do, which is eat right, exercise regularly, take care of yourself, and very importantly, get your blood tests and checkups done regularly, especially if you have a incidence of family history. And this goes, and oftentimes I see people who are in their 20s and 30s, women and men, who are having high blood pressure, but they don't really take care of it. And over a period of time, this accelerates. It causes a whole host of problems, whether it's kidney problems, heart problems, whatever, right? So it's very important to get yourself tested, take good care of yourself, work out, and very importantly, don't smoke, because cigarette smoking significantly increases the risk of heart disease. And all these risk factors that I just talked about, they have a multiplier effect in women. So they cause an X amount of, they increase the risk of heart problems in men to a certain extent, but that risk is amplified in women. So
All
it's
right.
important to take care of yourself.